Ibogaine drugs to fight addiction. Yes or no? By M. Edwards, Department of Psychology, Professional Studies, University of Aspen, AD 665, Neurobiology Dixon, Dr. Sayes, December 30th, 2020. This is my title page. Ibogaine is a century-old hallucinant shrub, which is native to West Central Africa and comes from the tablet ibogaine plant. There is great controversy surrounding this halogenic shrub. Researchers are currently doing studies on this drug to find out if it's safe enough to help with addictive behavior. In my presentation, I'll explain two sides of the controversial issue. In this slide, I will talk about two sides of the controversial issue. As I explained in the previous slide, there is two sides to this controversial issue. One group say that Ibogaine should be given to individuals with drug addictions because it can help cure people with drug addictions and give them back their life. This group of people say yes, that Ibogaine should definitely be used to treat drug addictions. Another group say that Ibogaine should not be used to treat drug addiction. These individuals say that it's too dangerous to use and there are serious side effects from this drug. You can even have heart failure and die. And therefore, this group says that Ibogaine should definitely not be used to treat drug addictions. This slide shows the first reason to the yes side, which is that it stops a person's cravings. One reason that people say that individuals with drug addiction should use Ibogaine is because it stops an individual's cravings of drugs. The individuals that say yes to Ibogaine say that Ibogaine will stop a person from craving any addictive drug that they may be taking. Ibogaine interacts with insulin, serotonin, and dopamine systems and orders these systems to stop producing dopamine, which causes you to crave drugs. Rodent studies where the rats were injected with Ibogaine shows that Ibogaine increases GDNF activity, and this increased activity decreased both alcohol and drug cravings in the rats. Ibogaine also plugs the dopamine receptors, meaning patients emerge with no cravings. It also works on NMDA receptors and transmitters, so they will stop asking for more of the addictive drug. Ibogaine successfully stops addictive tendencies in substances such as opiates, cocaine, alcohol, nicotine, and synthetic substances, so you no longer have any desire to use them. This slide shows the second reason to the yes side, and that is it can stop a person's withdrawal symptoms. Ibogaine can combat severe withdrawal symptoms such as depression and fatigue. It can also stop withdrawal symptoms such as fevers, chills, diarrhea, vomiting, delusions, paranoia, and extreme depression, which can be quite debilitating. If an individual has severe withdrawal symptoms, then they will reach for the drugs to stop the withdrawal symptoms. In rodent studies, when rodents were given Ibogaine, they immediately stopped administering drugs to themselves because they did not experience any withdrawal symptoms. Because the withdrawal was absent, they did not want the drugs, and there was a lesser chance for a relapse. This slide shows the third yes reason why Ibogaine should be used, and that reason is because it helps individuals find the root of their addiction. Ibogaine helps their patients to deal with personal experience in an objective way and find closure. The TRIP aspect of Ibogaine treatment enables patients to exact and work on the psycho-emotional aspects of addiction. Ibogaine takes you through all the bad addiction decisions you have made in your life in a chronicle order and makes you confront them. Therefore, it helps you get to the root of your addiction by confronting some underlying trauma or pain that caused you to start abusing drugs in the first place. The tree diagram shows all the anger, neglect, and abuse that may have happened in the past. One participant in Brown and Eccles study said, "I saw my family from the time I was born to now, and what caused the addiction to happen, and I wanted to change this addictive behavior." The final slide to this yes side is that Ibogaine totally changes a person's life perspective. The final side to yes of the debate shows that when a person takes Ibogaine, they have a very spiritual experience that changes their whole outlook on life. Instead of wanting to use drugs, Ibogaine gives them a major cardiac release. In fact, individuals after taking Ibogaine have quite an aversion to the addictive substance they come in contact with, and they no longer want to use them. Individuals who take Ibogaine start thinking more clearly. They are more relaxed, happier, and more positive about the future. Many of these drug abusers report that they feel cleansed or reborn. These patients were then able to formulate a plan to put the drugs behind them and to maintain a clean life as they move forward towards recovery. The first slide to the no side debate is that Ibogaine does not react well in people with concurring disorders. People with concurring disorders do not respond well to Ibogaine treatments. In fact, it makes their condition worse. In people with mental disorders such as schizophrenia, bipolar, paranoia, and panic disorders, the illness is elevated to higher levels. It causes extreme emotional reactions to some people, especially those who have experienced traumatic things in their childhood or adult life, such as physical and emotional abuse or postpartum stress disorder. Ibogaine also causes concurring individuals to go into a trance-like state, especially in schizophrenia, where the person will then dissociate from one's own body and from reality. It may be a trance that they never recover from. This slide shows the second no reason on why Ibogaine should not be used to treat drug addiction, and that is because Ibogaine causes body tremors. Individuals can experience severe tremors from taking Ibogaine. Ibogaine activates a certain area of the brain that causes the tremors to occur. In fact, tremors can be so prolonged that they can cause neural degeneration in certain areas of the brain. These tremors can also lead to neurotoxicology and severe damage to the cerebellum. Ibogaine kills off the tremors have toxic effects on nerve cells in the brain and the cerebellum. Ibogaine kills off many more cells in the cerebellum, and as a result, the person cannot move and becomes paralyzed. The next slide shows another no reason why Ibogaine should not be used in individuals with addiction is because it causes severe seizures. Ibogaine can cause severe seizures, and in particular tonic-clonic seizures. One patient studied by Gronin had seizures so severe that medication had to be given to him immediately in order to stop the seizures. As the cortisol levels in the brain began to rise, the seizures became more and more prevalent. It can result in epileptic seizures that range from petit mal to grand mal. These seizures can cause individuals to lose control of their body functions, and their body does many involuntary movements. Groner and al. Looked at case studies where individuals had seizures from taking Ibogaine. These individuals had seizures right after taking the drug, and many of these seizures caused severe brain damage. The final slide says that no Ibogaine should be taken for addiction because it can cause severe cardiovascular conditions. Ibogaine can cause severe cardiovascular conditions such as cardiarrhythmia. When a person takes this drug, their drug rate drastically increases and then decreases. This causes the heart to either beat too fast or too slow. It can also cause your blood pressure to go too high or too low. This produces disorganized electrical signals, so your heart does not know what it should do. Other heart conditions that Ibogaine can cause is cardiomyopathy. which is a thickening of the mitochondria, which is the heart chamber in the left ventricle. This makes it very difficult for the heart to pump blood to the rest of the body. Studies by Liebenberg and Ehrpaar show patients having suffering from this infraction to the left ventricle of the heart after taking Ibogaine. Liebenberg did case studies of individuals who took the drug over a period of time, and their left ventricle suddenly dilated, and he had the sudden heart failure and died. The final slide is a show that Ibogaine can help individuals with addiction, but it has to be closely monitored. Right now, the herb is illegal in the United States and in parts of Europe. In Canada, you can only get Ibogaine right now with a prescription from a doctor. Many people go to Mexico and South America on their own to get the drug. However, when a person is taking Ibogaine from another country such as Mexico or South America, the drug should be carefully monitored in a strict setting. They should be placed on constant observation, and their heart rate and blood pressure needs to be monitored and documented. Right now, more studies and more tight clinical administration guidelines need to be put in place before Ibogaine will be approved as a suitable addiction treatment in the United States. My slide 12 and 13 are my references. My references are Ehrpaar, KL, Static M, Jill, JR, 2012. Fatalities temporarily associated with injection of opium. The Journal of Forensic Science, 57, pages 398 to 412. Burla MP, Johnson ME, 2016, Classic Hallucinogens in the Treatment of Addiction, Neurobiology Psychiatry, page 250 to 258. Brown and Ehrpaar, 2018, Treatment of Opiate Use Disorder with Ibogaine, Detoxification and Drug Outcomes, the American Journal of Drug Abuse and Alcohol Abuse. Crossroads Treatment Center, March 2018, Ibogaine Legality, that's a map. Dejo, McGowan, Ravelin, H.A., 2015, Glider Cell Line, Neuropathic Factor meditates the dire actions of anti-addiction drug Ibogaine against alcohol consumption, the Journal of Neuroscience. Aaron C., February 28, 2020, Drug Rehab Recurring Brain Disorder, it's a chart. Grobin and General R. and Snow JWKOL, 2019, Ibogaine consumption with seizure-like episodes, Q prolongation and capture cardiac arrhythmia, Journal of Emergency Medicine. Gura T.L. 2008 May, Doctor Services taking blood pressure, the image. Holman, Swedner and Val, long-term syndrome induced by anti-drug Ibogaine, New England Journal of Medicine. James, a blog, Ibogaine trigger of alcohol and drug addiction, highly dangerous, the Perry Clayman Project. Johnson's E, drug trials. Legacy Health, September 18, top illegal drug picture. Lidison, how toxic is Ibogaine, clinical toxicology. Make my burden light, the EMDR tree therapy, the tree, to treat addiction, the drawing, the roots of addiction. Meryl S. Govan, R.B. Carroll et al. Ibogaine administration monitors GDF expression in brain regions. MASH, copium medication, development of Ibogaine as a psychotherapy for drug dependence. Annual New York Academy of Science. NASH DC, can a drug in Gavin cure addiction? That's the wellness. National Academy of Neuropathology Foundation, epileptic seizure, the illustration. Natural Quack, the prescription drug monitoring program, the doctors writing the prescriptions. North Point staff, 2018 September, the withdrawal infographic. Pigfields, heart rate monitor in a hospital. Rosen, the body tremor and involuntary shaking. Several structure change of failure and footsteps to life, the motivational poster. Scherer, Ibogaine, Crovin, the image. And the University of Diagnostic Medical Imaging, 2020 February, the cardiovascular disease images.